This video will cover the contraceptive implant, Nexplanon. The implant is a small plastic rod that sits under the skin in the upper arm. It lasts for 3 years and is very effective in preventing pregnancy. In the first year of use, only 1 in 2,000 women will become pregnant, which makes it one of the most effective options available. The implant releases a small amount of hormone, which prevents your ovaries from releasing eggs. It takes 7 days to start working, so we advise you to use condoms or another form of contraception for the first 7 days. Once the implant is removed, your fertility will return quickly. The main side effect is a change in bleeding pattern. Some women will not have any bleeding, some women may have irregular or prolonged bleeding. Occasionally women continue to have regular periods. It does vary from person to person, and the bleeding can also change over time. If you're troubled by the bleeding, you can contact the sexual health clinic or your GP. There is normally something we can do to help. Some women find acne can become worse, but for some it can improve. There's no evidence to link depression, weight gain, or headache with the implant. If you do suffer these side effects, they're normally short-lived. If they persist, you can speak to your GP or the sexual health clinic. The implant can be inserted in one of our clinics, and some GPs also offer this service. We'll check your medical history on the day and do a pregnancy risk assessment to make sure that you're suitable for the contraceptive implant. The procedure is quick and will be performed by a trained healthcare professional. First of all, we clean and then numb the skin with some local anaesthetic. Once the skin is numb, we insert the implant with a small applicator. We then apply some small plasters and a bandage. There are a few risks to having an implant inserted, but most women do not have any complications. The risks will be discussed in detail with you on the day of the procedure. Bruising is common, and there will be a very small scar from the insertion site. There's a small risk of infection, allergy to the implant, or pain. Rarely, the implant may be inserted too deep. It still works, but you may need to be referred for removal. In extremely rare cases, the implant can move or cause nerve damage. Some medicines can stop the implant from working. Examples include medicines used for tuberculosis, HIV, epilepsy, and the herbal remedy St. John's wort. If you start any new medication, always check it's safe to use with the implant. This includes over-the-counter medicines.